Hi everyone, and welcome to week 1 in Health and the Public. This week we will be learning about how to become familiar with this course, being able to define health, the public health, and public health stakeholders, explain the core functions of public health, describe how epidemiology fits into the public health model, explain the limits of using epidemiology and public health, and develop interventions aimed at different levels of prevention. And those levels are primary, secondary, and tertiary. This week's assignments include a scavenger hunt, a Chapter 1 quiz, public health blog, why is public health controversial graphic organizer, and then federal agencies involved with public health wiki, and finally your discussion board. I'm going to exit out of this so I can show you how to complete those assignments that are due this week. So here's our week 1 folder. You have your online scavenger hunt assignment, and the purpose of this assignment is to help you not only get familiar with our course in Blackboard, but also with our syllabus. So to complete this assignment, I would say you'll need to use Blackboard, the syllabus, and also watch the orientation video posted under announcements. And then you can use all of that to answer the questions down here. So how to prepare for the class, course materials, and such. You will answer directly onto this document. Once you have completed the document, go ahead and save it onto your computer. And to submit the assignments, what you're going to do is, sorry, I lost it. Click on the title here where it says Scavenger Hunt. You'll scroll a little bit down under Browse Local Files. This is where you would find your document and attach it there. And then click on Submit. And then your document will be submitted. Okay, going back to week 1. So this week you'll be reading chapters 1, 2, and 3 in the textbook. I have also attached the PowerPoints here if you're curious about looking into them a little further. Other assignments include what is a public health blog? And so to put your information into this assignment, you would just click on it. And up here where it says create blog entry, you would click on that. Write your blog entry, and down here where it says post entry, that is how you would submit a blog assignment. Now, submitting a wiki is very similar to submitting a blog. Let me scroll down there really quick. You can see this is a wiki. So federal agencies involved with public health. You would click on this. And for this, there are 2 ways to put in your information. I guess one is it'll bring you right to the page. You can enter it in and then click on submit. There should also be another link that says edit wiki page. You can also use that to create your information or to submit your information. The one thing I ask is you are more than welcome to put comments in at the bottom, but those are not graded. So please do not enter your comments as your assignment. The other assignment that is due this week is why is public health controversial? And so in chapter 2 of your textbook, it talks about why public health is sometimes controversial. For this, what I'd like you to do is to create a graphic organizer telling me why is public health controversial. I've also included a website here. If you are unsure what a graphic organizer is, you can go to this website, which will give you a little more information about graphic organizers. Of course, you can also Google graphic organizers to gain a little more information on what they are. But again, as I said, you'll be creating a graphic organizer for this assignment. If you are comfortable using Microsoft Word or Microsoft Excel, feel free to use those programs. I have provided 2 optional websites here. Both of these are free, and you can use them to create your graphic organizer. MindMap is here. To create it, you would just click on the link where create a free map. Bubble Us, you could create an account, but it is free. So to create it, you would just click on New Mind Map. Oh, I thought I was already signed in, and I am. All right, so here's the center of my mind map. To enter information, the center is usually the title. So here I would write, why is public health controversial? And then to add in tabs or add in boxes, I would just click on this little plus here. So add child, meaning it will be pointing to that box. And I would write my answer here, if I could spell it right. Still struggling, as you can see. But then you may want to define what this answer is, whatever you write here. So you would make another box that, let's see how that turned out. That's not what I wanted. Here. To point to this, where I can go into a little more description. When you're finished with creating your graphic organizer, you would just click on this where it says Save As. You can save it as a PNG, which is an image, a JPG image, up to you. And then you could attach that as your assignment. And again, you attach it the same way that you attached your scavenger hunt. You would click on the title and attach it over here where it says Assignment Submission, browse local files, attach, and submit. So that is the third assignment that is due. There is a quiz, chapter 1 short quiz. You have 20 minutes to complete it, and you can take it twice. So take it the first time, see how you do, and you are more than welcome to take it again to improve your grade. Blackboard will use the highest grade for that quiz. And then we have our discussion boards. Discussion boards will be every week. If you recall from the syllabus, your initial post is due by Wednesday, and your follow-up posts are due by Sunday. Each of you have been assigned a group. So your page will look different from mine when it comes to this. You will only have one group number to be able to select. So you would select your group number, scroll about halfway down, and where it says here, Group Discussion Board, go ahead and click on that, and that will bring you to your group's discussion board page. This week we are in week 1, so you would just click on Week Introduction Post, create thread, and this is how you would write and submit your post. So you would answer the questions that are over here. If you would like some extra credit points, you can include a picture of yourself. To include a picture of yourself within your post, you would click on this plus sign and insert local file. Then you would find your picture and insert it into the text. Once you have written all your information and inserted a picture, you click on submit, and that's how you would submit your discussion board post. If you recall, you are to reply to your group members' discussion board post by Sunday, and this is all the people in your group. To do it, you would just click on their post, read through it, and at the bottom where you see here, click on reply, and here's where you can reply to the different people in your group. All right, let's now talk about what we're going to be talking about this week. So first we'll talk about chapter 1, what is public health, and we'll talk about the science and the politics, what encompasses public health. So public health is fulfilling society's interest in assuring conditions where people can be healthy. It's organized community efforts aimed at the prevention of disease and the promotion of health. So it's twofold, right? Not only just to prevent diseases, but to promote health. And there are 3 core functions for public health. Assessment, so to look in the community and assess their health. To create policies that promote health. And assurance, to assure that each person can fulfill their own levels of personal health. And when we think about public health, it is different from the medical model, the medical care. In medicine, the patient is the individual. In public health, the patient is the community. Public health diagnoses the health of a community using public health sciences. And when we think about treatment of a community, it's not getting a shot or giving antibiotics. It really involves new policies and interventions that are aimed at a bunch of people, not just one person. We think about the goal of medicine is to cure, whereas the goal of public health is prevention of disease and disability. We think about the role of science in public health. Science is how we understand threats to health. It's what we use to determine what interventions might work and evaluate whether or not those interventions have worked. Politics is how we as a society make decisions about what policies to implement. So think about politics is how we decide what's important right now. There are many disciplines that fall under this umbrella of public health, and they include epidemiology, statistics, biomedical sciences, environmental health sciences, social and behavioral sciences, and health policy and management. Epidemiology is really the basic study, the basic science of public health. It is the study of epidemics, which is probably a term you've heard a lot recently, right, with COVID. But the goal is to control the spread of infectious diseases. It also looks at the causes of chronic diseases and ways to limit harmful exposures to limit chronic diseases as well. We look at statistics. They look at a collection of data on populations. The numbers are basically diagnostic tools to make a judgment on the health of a community. And the science of statistics is used to calculate risks, benefits, as it relates to health. Biomedical sciences look at infectious diseases, specifically the pathogens that cause those diseases. So think about the bacteria, the viruses. Those would be pathogens that cause infectious diseases. They also look at chronic diseases. Chronic diseases are usually longer lasting and are related to behavioral choices rather than pathogens. So for example, if I'm at higher risk for lung cancer, perhaps it's due to my behavior of smoking rather than being exposed to a virus. In addition, they also look at genetics. Environmental health science looks at the health effects of different environmental exposures. So a few years ago, there was the lead in the water of Flint, Michigan, and what was the impact of lead poisoning for those people that were living in those communities. They look at air quality. I just talked about water quality, solid and hazardous waste, safe foods and having safe drugs, and looking at the global environment change and how that impacts local resources. Social behavioral sciences is now a leading factor in affecting people's health. Behavior is a leading factor in affecting people's health. So behavior in terms of what I choose to eat, do I choose to engage in activity, do I choose to engage in risky or safe behavior? These are behavioral choices. Theories of health behavior, they look at social environments, how the social environment affects people's behavior. Currently in the United States, our major health threats are tobacco, poor diet, physical inactivity, and injuries. And when we think about maternal and child health, this tends to be a social issue. And then lastly, health policy and management. What is the role of medical care in public health? The cost of medical care in the U.S. is currently out of control. U.S. has the highest percentage of population without health insurance, even to this day. And the highest percentage of population without health insurance, we are talking about industrialized and developed nations. And these people who don't have access to health insurance also don't have access to health care, or have access to health care that the quality is not as good as those who have health insurance. And the quality of medical care can be measured and is often questionable amongst those people who don't have health insurance. So as I mentioned earlier, part of the focus for public health is really to prevent diseases. Prevention is the best way to do it because a person doesn't get sick. It's the cheapest and most effective. But there are 3 levels of prevention. Primary prevention is preventing something before it even occurs. So preventing kids from starting smoking cigarettes, right? That would be a primary prevention. So to do so in schools, you probably would have advertisements about the dangers of smoking, why you should never start smoking and such. Those would be considered primary prevention. Secondary prevention is the behavior or the risk has started, but it's still new. So for an example of secondary prevention would be teenagers getting caught smoking cigarettes. Taking that group and putting them into a smoking cessation club or into a group to help you stop smoking, that would be considered secondary prevention. Because the risk has already started, but it's early enough in the infancy of starting that it's easier to quit smoking when you're just within a few weeks of smoking than it is if you have a lifetime of smoking. Another example is for secondary prevention would be identifying students who have failing grades and providing them with tutors or support services to help them raise their grades. And then last is tertiary prevention. And tertiary prevention is when the health behavior or risk is at its height. So an example would be people already diagnosed with cancer. What can we do now to make it better for them? Students who have already failed out of school or failed out of college. What can we do now to help them get back on track? When we look at the public health approach, first they have to define a health problem in a community or amongst a group of people. Then they identify risk factors associated with that problem. So what are the risks for making that problem? They will then develop and test community level interventions to control or prevent the cause of the problem. They will implement interventions to improve the health of that population, and then monitor that intervention to assess how effective was it, did it work? When we look at infectious diseases, now these are diseases you can catch. There are 3 factors one has to consider. The agent is the pathogen, whether it's a virus, a bacteria, a fungi, etc. The host, excuse me, is the person that's infected or animal that's infected. And then the environment is the environment where it's in. When we look at interventions for preventing infectious diseases, we really can focus on any one of these. We can focus on the agent, which is the actual pathogen itself. So if we're looking at, let's say the flu, right? One of the prevention methods that seems to be pretty high functioning is giving people vaccinations for the flu, right? So that's aimed at the agent. For the host, for that same example, perhaps it is making sure people know how to wash their hands properly. So you're impacting the behavior of the host to reduce the risk of getting the flu. And then lastly is the environment. And perhaps this would be learning how to clean surfaces properly so that the flu virus cannot live on those surfaces. So chapter 2, and this is the part that you're going to do your assignment on. Why is public health controversial? So here are the sources of controversy when we talk about public health. 1 is the economic impact, or the money. 2 is individual liberty. So think about freedom of choice versus being told what to do. 3 is moral and religious concerns. And then 4, as you know, I'm sure, is the politics versus the science. So the economic impact. Businesses often resist public health measures because they affect the profit margins. Those who must pay may not be the ones who benefit. Costs may be short-term, while benefits may be long-term. But the costs are oftentimes more easier to calculate than the benefits. For example, there have been enough studies to suggest that companies that offer a fitness center and wellness coaching have employees that are healthier. What does that mean? Is that if they put the money up front to hire health coaches, to put together a fitness center for their employees, let's have a cafeteria with healthy, nutritious food, those are all programs that will cost money, and you can pretty much figure out how much they cost per person. When we look at the benefits, so research shows that employees are happier at their business, they take less sick days, they're more productive at work. But those are things that are harder to calculate in terms of direct cost savings. And so that is what I mean when I say that the costs are easier to calculate than the benefits. It's easy to calculate how much something costs. It's harder to calculate what those benefits are in terms of money. If I'm a happier employee, what does that mean money-wise? Probably I'm more productive and I do a better job. But that's hard to put an exact dollar figure to. So this another notion is called tragedy of the commons. And it's exemplified in many environmental laws, such as I should have the personal freedom to pollute. But how does that impact others? And if I pollute, does that infringe on the freedom of others? And we think about this idea of personal freedom and limitations of those personal freedoms. So when can the government start restricting our individual freedom? One, which is generally accepted by everyone, is to prevent the harm to others, right? So I do not have the freedom to go hit someone else or to hurt someone else. Paternalism is acceptable for children. And so what that means is that I can limit behaviors to make it safe for children, so that I am acting as a parent to children, right? So that, think about child labor laws, human trafficking, things like that. To protect individuals from their own actions. Now, this is opposed by people who consider themselves libertarians, but for this would be laws that you have to wear a seatbelt. You have to wear a helmet when driving a car. You have to be 21 to drink alcohol. So these are all laws that are geared to protecting someone from themselves, essentially. And then for the common good. And so the common good is that I'm restricting your individual freedom because it's better for everybody else if I do. An example would be drinking and driving, right? That is a law that's geared towards the common good, that you don't put others at risk due to your decision to drink and drive. Now, we're talking about moral and religious concerns. Think about the idea of sex and reproduction, the ability to hand out condoms for free, right? There are many people who are religious that would say absolutely not, because you're not supposed to have sex until you're married, and giving out condoms is telling people that they can go have sex. On the other side, people say, well, we want people to be protected and not get STIs, so handing out condoms is a good idea. So anytime we talk about sex, it's going to have religious and moral implications. Same with alcohol and drugs. Is it my right to take any substance and put it in my body? Or should that be limited? Do I need the government to save me from myself? And another example are assisted suicide and other end-of-life decisions. So if I have a terminal illness, is it okay for someone to help me commit suicide? No, it's not. And in fact, suicide is illegal, although really, what's the consequence, right? But suicide is illegal. And we talked about politics versus science, which I think has really been magnified over the past few years, but there's always this possibility of tension. There's always tension between politics and science. So the conservative control of federal government intensifies this conflict. During Bush's era, they felt he went too far in misrepresenting science to support policies. And then the Obama administration was call it an honest science to inform policy-based decisions. But even looking at these two statements, I mean, these two statements are still politically charged, and this was written before Trump's era, but imagine what this would say about Trump's era in science, and it would depend on who's writing the book. Our last chapter for this week is Powers and Responsibilities of Government, and we look at the federal versus state government. In the U.S. Constitution, there is a statement that we need to promote the general welfare of people in the United States. The Reserve Clause is that since health is not mentioned in the Constitution, the primary responsibility therefore belongs to the states. Interstate commerce, there's an interstate commerce clause that justifies the federal role in some of the cases. And the power to tax is widely used by the federal government to control public health policy. The branches of the government, just a little review, is the legislative is to pass statutes, executive, where the public health agencies carry out the law. Many issue regulations consistent with statutes. And then judicial are the laws and regulations that are challenged in court, and they're either upheld or then they have to go back and be relooked at. And in addition, there's lots of local public health agencies. There are county public health agencies, city public health agencies, and they are charged with looking at the day-to-day responsibility. They have core public health functions. They're also responsible for providing medical care for the poor, underinsured, or uninsured. Their funding sources, though, vary widely by the city, by the county legislatures. Oftentimes they're not understood by people about the importance of having local public health facilities, and mandates may be funded either by the state, or sometimes the federal government does provide money to our local public health agencies to follow through on certain things. For example, especially with the COVID, is that many health agencies received federal funding to help control the COVID outbreak. State health departments are controlled by the state, and what they also do is coordinate the activities of the local health departments. They also collect and analyze data. They offer laboratory services. State health departments manage Medicaid. They also manage licensing and certifying medical personnel, facilities, and services, and often include environmental health, mental health services, social services, the aging population, or sometimes those are also given to other agencies. The federal government has the Centers for Disease Control and Prevention, and this is really the main epidemiologic and assessment agency for our nation, for the United States. They publish a morbidity and mortality weekly report, which is how people die and get disabled. And within this is a Center for Health Statistics, and they collect data on U.S. population concerning all aspects of health, death, and disability. And then also embedded are centers for infectious diseases, chronic diseases, injury prevention, and some others as well. Federally, we also have the National Institutes of Health, which contains our biomedical research agency, the Institutes on Cancer, Heart and Lung Disease, Diabetes, Aging, Child Health and Human Development, and others, the National Library of Medicine. They have laboratories in Bethesda, Maryland, and provide grant funding to researchers and universities and research centers as it relates to health. And they also have a clinical center where medical researchers test experimental therapies on patients. In addition, there are many non-governmental public health agencies. So these are not funded by the federal government or the state government. They're private agencies, essentially, and these include the American Cancer Society, the American Heart Society, American Diabetes Society. As you can see, there are many here. There are consumer groups, but these are not government agencies. These are separate from the government. That concludes our PowerPoint for week 1. I hope you have a wonderful week, and let me know if you have any questions or concerns.